And the last section that we're going to talk about tonight are personality disorders. So the personality disorders are actually split up into three groups. Personality traits are stable patterns of thought, feelings, and behavior. So when a person has a personality disorder, there is a stable pattern of behaviors that deviates from the cultural norm. It can impair functioning, and it causes internal and interpersonal distress. So personality disorders create dysfunction in two or more of the following areas. So affect, cognition, impulse control, and interpersonal functioning. So the current disorders are divided into three clusters based on the types of behaviors demonstrated. So the first cluster we're going to talk about is cluster A. And these personality disorders are those that are associated with irrational thinking, social withdrawal, and suspicious behaviors. So in paranoid personality disorder, for example, the person is irrationally suspicious of others and often misinterprets others' motives to be deceiving or harmful despite any sufficient evidence. So these are the people, everyone is always out to get me. My friends, my family, everyone is out to get me, and it's just part of their personality. And it's very maladaptive, and it's very hurtful to interpersonal relationships. People like this, they have a very hard time keeping up their relationships because they're so paranoid. We also have schizoid personality disorder, which the person's usually a loner. They have little interest in any type of interpersonal relationship. They don't really care for friendships. They don't really care for their family relationships. They have no interest in romantic relationships. And a lot of times they're completely satisfied with that. It's not something that causes them distress. It's just the type of person that they are. It's just that's the way they see their personality. It's not distressing to them. However, they may come off as detached or cold to other people. So that's wherein I think DSM decided to consider schizoid personality disorder an actual disorder, because it's not directly causing the person stress, but it is impairing interpersonal relationships. So yeah, that would be considered disordered. And then we have schizotypal personality disorder, and the person will usually experience interpersonal issues again due to some or all of the following: limited or inappropriate affect, magical or paranoid thinking, odd beliefs, behavior, speech, or appearance. So these are the people that are, to their core, just different, very strange. They'll employ magical thinking. They have these really strange beliefs. Sometimes they dress in extremely bright colors. Sometimes they speak strange. They use, maybe their vocabulary is weird. Maybe they'll speak with a strange accent or something like that. And many of these cases actually eventually develop into schizophrenia, because a lot of positive symptoms that are present in schizophrenia are also present in schizotypal personality disorder. Okay, so moving on to cluster B of the personality disorders. So antisocial personality disorder is one in which a person will regularly display aggression against people or animals, deliberately destroy property, lie, steal, and intentionally violate rules. So a person must also have a history from the age of 15 of dishonesty, illegal activity, impulsiveness, and a lack of remorse. So there are a couple of childhood disorders that sort of indicate whether or not a person is at risk of developing an antisocial personality disorder. And it was, I believe, previously in DSM, there wasn't so much an antisocial personality disorder diagnosis as there was a psychopathy diagnosis. And psychopathy sort of is more so about the thought process and the cognition behind it, whereas antisocial personality disorder, we're really concerned with the behavior of the individual. So they are similar. A lot of people with antisocial personality disorder will probably also test very high for psychopathic traits, a lack of empathy, lack of remorse. But these, it usually affects men more so than women, and a lot of prison inmates are found to have antisocial personality disorder as well. Borderline personality disorder, a person suffers from instability in mood, impulse control, an image of himself or others. So an instability in all of those is basically what borderline personality disorder is. Shifts really quickly. The person may also have a terrifying fear of abandonment. They may develop self-harming or suicidal behaviors. There's increasing evidence that borderline personality disorder is actually a generalized form of bipolar disorder and a very severe form of it. Borderline personality disorder, I think, affects women slightly more than it does affect men. And we have histrionic personality disorder, which is kind of interesting. The person has a strong desire to be the constant center of attention through personal, and they accomplish this through personal appearance and seductive behavior. The individual may demonstrate very intense and dramatic emotions, but they're often shallow and fleeting. So sometimes it's very superficial. Their emotions are very much for show. Sometimes these people will misinterpret their relationships. They'll think that they have much, much deeper relationships with people than they actually do. But basically, they just need to be the center of attention, and they will do whatever possible to become the center of attention. And a lot of times, it's through seductive or sexual behavior. So in narcissistic personality disorder, the person feels extremely self-important, often experiences fantasies of beauty, brilliance, and power. This person feels a strong desire for admiration, and they characteristically lack empathy. So I'm sure everybody knows a person where you could self-diagnose them in your head with narcissistic personality disorder, but it can be an issue. Again, that person probably does not think that their personality is a disorder. Sort of like what we were talking about before with schizoid personality disorder. However, it does have a serious impact on interpersonal relationships. It's very much a turnoff for a lot of people when someone is so delusionally self-involved. So again, that's probably one of the driving factors behind why narcissistic personality disorder was classified as a personality disorder. And the last cluster is cluster C, which we have 3 more disorders. So in avoidant personality disorder, the individual may feel inferior and undesirable, and their fear of criticism or conflict leads them to avoid interpersonal relationships and new activities. So these are the types of people that do not have good self-esteem. It's basically the exact opposite of narcissistic personality disorder. They do not have good self-esteem. They are terrified of rejection. They are very scared of criticism. They're not good with conflict. And that leads them to avoid interpersonal relationships and new activities because they're so anxious about that all the time. So in independent personality disorder, the person feels the need to be taken care of by others and has an irrational fear of being left alone. So hence the name dependent personality. So they may not be able to make decisions. They're not good at making decisions. They feel more comfortable when other people make decisions for them. And they're desperately trying to seek the approval of others before they do anything. If they want to do something, they'll probably have a point person where they need to get that person's approval before they do something. Even if it has nothing to do with the other person, they just need that assurance that what they're doing is a good idea. They need that dependence on another person. So they're often taken advantage of because they will tolerate almost anything to gain support and avoid abandonment. So it can even go as far as abuse. They will tolerate it because they need that support and they so desperately need to be dependent on another person. So obsessive compulsive personality disorder, which is cross-listed with the OC disorders, this is personality-wise. This is part of who they are. They have a very rigid, stubborn, and controlling personality. They'll resist authority. They won't cooperate unless they're in control. So when we colloquially use the word OCD, we are actually more accurately talking about OCPD because we discussed before about what obsessive compulsive disorder actually is, and it's not just liking things tidy. OCPD is more so like that. You're very rigid, you're very stubborn, you cannot take input from someone unless it is your input. You have to do things your way. You're going to resist authority, and you're not going to cooperate with anyone unless you are the one that is steering. These people can also be depressed and they can also have trouble expressing affection. So again, you can see why this is extremely detrimental to interpersonal relationships.